And we are right at the top of the hour, so we will go ahead and get started. Again, just want to welcome everyone today to our webinar, Long-Term Care Services and Supports, LGBTQ plus Equity. I'm Cheryl Wayland, she, they pronouns, and I'm the Senior Director of Special Initiatives and Partnerships at SAGE. This webinar is being recorded and will be uploaded to the SAGE National Resource Center website at lgbtagingcenter.org. You can turn on closed captions on your toolbar using the CC button. If you aren't seeing that, you can click on the three dots by the More button, and that should pull up your closed captioning. Should you have questions for our panelists today, we ask that you please use the Q&A button on your toolbar. And for any questions that aren't answered, we will answer those and create a Q&A document that will also be linked along with the recording on the website. And I'm excited to be joined today by our speakers and co-host organizations. We have Ari Lazarus, Federal Trade Commission, Lisa Shefferly, Consumer Fraud Protection Bureau, and Lori Mars with the National Center for Elder Abuse. I'm truly excited and appreciative for the collaborative relationships that we've established with each of your organizations over the years in support of LGBTQ plus equity. And with that, we'd like to turn it over to Lori to get us started today.
Thank you so much, Cheryl. Hi, everyone. It's great to be here with all of you. Next slide, please. I'm Lori Mars, Deputy Director of the National Center on Elder Abuse. We are one of 9 elder justice resource centers funded by the Administration for Community Living. We're housed at the Keck School of Medicine of USC and provide the latest information, resources on research, training, policy, and best practices on intervention and elder mistreatment. Our goal is to improve the national response to elder abuse through our comprehensive data repository, the synthesis and dissemination of evidence-based practices, and state and national collaborations to support elder rights and justice. Next slide, please. Today, I'm going to briefly address the concerns of older LGBTQ+ community members about nursing homes and strategies to promote culturally sensitive and responsive care. As we all age, we're exposed to an increased likelihood of having medical conditions and functional impairment that may require care and attention. LGBTQ+ elders who've experienced widespread life course discrimination and significant disparities within healthcare and social service systems are at an even greater risk of poor health outcomes and corresponding care needs in older age. Next slide, please. Yet despite the increased need for assistance, LGBTQ+ older people are less likely than cisgender elders to have the traditional support networks to help respond to common care needs that may arise in later life. They're less apt to receive support from families of origin, less likely to be partnered and have adult children who can provide care, and more likely to live alone. LGBTQ+ older adults frequently rely on families of choice consisting of friends and other loved ones, a support system that unfortunately often decreases in size over time. Older adults also report higher rates of social isolation. These collective and compounding factors, the health inequities in outcomes, the increased need for assistance, fewer family and chosen family connections, and social isolation, often result in a higher anticipated need for formal long-term care services such as nursing homes. Notwithstanding, though, the potential need for long-term care, there's a prevailing sense of distrust and fear among LGBTQ+ older people about the availability of culturally competent services and quality health care in nursing homes. Next slide, please. Community members have expressed a number of fears, including worries of physical and psychological harassment by facility staff, discrimination from fellow residents, social isolation, rejection, and marginalization, being involuntarily outed, misgendered, and the lack of culturally responsive and quality care. A number of studies affirm these concerns. A report from AARP found that more than 50% of LGBT adults were concerned about neglect, abuse, the refusal or limited access to services, verbal or physical harassment, and being forced to deny or hide their identity should they require long-term care. Another study found that 89% of LGBT older adults and service providers who were surveyed believed that staff would discriminate against an LGBT resident. 53% believe that staff would abuse or neglect an LGBT resident. And in a survey of gay and lesbian older adults, 73% responded that they believe discrimination occurred in residential care settings. 70% of LGBTQ plus older people expressed concern they'd have to hide their identity in a long-term care setting. Very interestingly, one study found that LGBT individuals over the age of 55 were 83% more likely to conceal their identity as compared with LGBT younger individuals, indicating that fears may be especially pronounced for older adults who feel more vulnerable at this stage of life and for whom long-term care may be more reality than a potentiality. Next slide, please. The fears expressed by LGBTQ plus older persons are often well-founded. Studies have reported discriminatory practices by some institutions, personnel, and peers. Instances have included physical attacks, psychological abuse, and microaggressions by staff and fellow residents. Other harms include the denial of visits from partners and families of choice, the refusal to allow same-sex partners to room together, and disallowing same-sex partners from facilities. One study reported that a trans woman was forced to live in the men's wing of a care facility. Many nursing homes assume heteronormative patient populations, and some administrators and staff harbor and express homophobic prejudices and heterosexist assumptions. Studies have shown that facility staff hold more negative views about same-sex sexual relations between residents relative to different sex intimacy. Staff have also expressed discomfort caring for LGBT patients. Even among staff who reported acceptance of LGBT residents, more than 20% felt their coworkers would provide inferior care. In addition to discriminatory practices, there are significant gaps in knowledge regarding LGBT health and care. Although online trainings exist, few facilities require staff to participate in them or demonstrate knowledge on LGBTQ plus older adults, resulting in providers who are ill-prepared to support residents. Next slide, please. As you can well imagine, the impacts are consequential. Physical and mental health consequences, distress, feelings of fear and shame, decreased access to and utilization of healthcare services among LGBTQ plus older people. In addition, reinforced invisibility of LGBTQ plus older adults, and a concern of the denial of competent and quality care, and the right to live authentically within a supportive community in older age. Given these alternatives, many older people choose not to disclose their sexual orientations out of fear of discrimination, condemnation, and exclusion. Concealment of identity alone can increase stress in LGBTQ plus individual lives and adversely impact health outcomes. It should also be noted that approximately 20% of LGBTQ plus elders are people of color who as a group face increased disparities, higher levels of stigma, and more LGBTQ plus prejudice than their white counterparts. Next slide, please. There are strategies to improve nursing home care, and among them, training long-term care administrators and direct care staff to provide LGBTQ plus inclusive and culturally competent care for older adults, developing sensitivity and implicit bias trainings to better understand and respond to the needs of LGBTQ plus residents, developing and implementing organizational anti-discrimination policies that protect LGBTQ plus populations in healthcare settings, integrating LGBTQ plus health and care into graduate and continuing education programs for providers, and advancing legislative initiatives to promote quality of care and best practices. In a couple minutes, you'll hear from Cheryl about the outstanding work being done by SAGE and the Human Rights Campaign Foundation through their long-term care equality index, making big and significant differences in long-term care. Another opportunity for intervention is through research. Although there is increased attention to LGBTQ plus aging among researchers, LGBTQ plus older adults remain a largely understudied population. Future research can examine the role of providers' attitudes on the care given to residents and provider characteristics that promote culturally competent care. Researchers must also study the unique needs of subgroups within the LGBTQ plus community. Although often grouped together, the LGBTQ plus community represents distinct communities, for example, gay men, lesbians, bisexual men, bisexual women, transgender individuals, etc., each with its own unique combination of health risks and protective factors. In addition, the health of LGBTQ plus populations lies at the intersection of other identities, such as race and ethnicity, socioeconomic status, disability status, and immigration status, all of which individually and collectively impact the experience of seeking and receiving appropriate health care. Considering these factors in research and practice will contribute to more equitable, culturally informed, and competent care and better outcomes for LGBTQ plus older people. Next slide, please. Please see our NCEA publications library. We have briefs and fact sheets for more information on this topic. Next slide, please. Or please feel free to reach out to us, to the NCEA, through the context referenced on the screen or the QR code provided on the screen. Next slide, please. And thank you so much for listening to this presentation. I'm going to turn it back to Cheryl now. Thank you.
Thank you so much, Lori, for giving us that really in-depth look at LGBTQ plus aging and the work that you all do through the National Center on Elder Abuse. I want to now share some of the work that we do nationally at SAGE and with some of our partners around the country in support of LGBTQ plus equity, with a specific look at long-term care communities. SAGE was founded in 1978 with headquarters in New York City, and we really work to lead in LGBTQ plus aging within aging communities, as well as represent aging within LGBTQ plus communities. I wanted to start out today by looking specifically at one of our newer programs called the Long-Term Care Equality Index. When we think about long-term care services and supports for LGBTQ plus older people, one of the biggest concerns that we oftentimes hear is what will happen to me as I age? Should I need to move into a long-term care community? Will I be able to find a place that's safe and welcoming? And when I first started doing this work in 2015, one of the things that I heard from a group of older women was that they didn't feel that they would be able to remain in their community where they had lived, worked, and played their entire lives. And they felt that they would have to move to a new city or state that was LGBTQ plus welcoming should that time come when they needed long-term care. And for me, this was really what I think empowered me to do this work. And the Long-Term Care Equality Index is a joint program with SAGE and the Human Rights Campaign Foundation. And our goal is to really promote equitable and inclusive care for LGBTQ plus older adults in residential settings across the country. This work was started in 2019. And in 2030, we released, or 2023, sorry, I jumped into a time machine and went to the future. In 2023, we released our first report, the Long-Term Care Equality Index. And this report profiled 200 long-term care communities across the country. And for this report, we're looking at benchmarks in 4 areas. That includes non-discrimination, staff training, resident services and supports, employee benefits and policies, and resident and community engagement. And on the next few slides, we'll talk a little bit about what we learned from these communities. We have 3 tiers that we look to highlight in this work. The first being the leader tier. This would be for communities that are meeting the most benchmarks, and 7% of the 200 participants fell into this leader category. Then 69% fell into the high performer, Another 4% were at the builder, and we had 21% that did not receive a tier. And what this means is that they've made a commitment to be LGBTQ plus welcoming and inclusive, but they're still working to implement some of these best practices, policies, and procedures. And we'll continue to work with them and add them to the tiers as they update their work over the next year. We also wanted to highlight where some of these communities are. We're in 34 states with communities that are LGBTQ plus welcoming and have taken part in the Long-Term Care Equality Index. And you can see these states, they're orange, tan, kind of a teal blue, and purple. And I wanted to highlight, some of the states where we might not expect to see welcoming long-term care communities, such as Mississippi, Alabama, Florida, Texas, Missouri. These are states that had a large number of anti-LGBTQ plus legislative efforts over the past year. And, so we're really encouraged to see that long-term care communities are stepping up and being a part of this LGBT inclusive work. Again, some of the areas that we looked at include non-discrimination, including staff training. So 90% of the communities had LGBTQ plus inclusive resident non-discrimination policies. Resident services and support is another area that we looked at. And some of the areas that we're really wanting to see policies around include rooming policies that encourage same-sex couples to be able to live together should they need to move into a long-term care community. We're looking for ways that they're honoring LGBTQ plus residents, such as, during Pride Month or during LGBTQ plus History Month. And we also found that several have inclusive policies around sexual expression and gender identity. So those are all areas that we look at within the resident services and supports. Another area that we consider is employee benefits and supports. Do they have inclusive medical insurance? Do they offer bereavement support for same-sex domestic partners or their immediate family? Are they offering transgender inclusive healthcare? And do they have written guidelines should a person transition on the job that helps make sure that they're being supported during that gender transition? And another area that we look at is resident and community engagement. I like to say that this is going beyond the rainbow flag and making sure that people are really implementing best practices and policies that support LGBTQ plus residents. Our next part of this work is to launch our next report, which will happen in 2025. And in between now and 2025, we're looking to, work with more long-term care communities that want to be a part of this work. If you know of a community in your city that should consider being a part of the Long-Term Care Equality Index, please feel free to share this information with them so we can engage with them and add them to our map when our report comes out in 2025. I now want to share briefly about some of our other programs that are really supporting LGBTQ plus equity at the local and national level. One of those programs is our National Housing Initiative. And you can see on the map in front of you, the states in orange are communities that have, or states that have LGBTQ plus welcoming affordable housing. And part of the work through the National Housing Initiative is to work with local communities that are wanting to develop affordable housing that's LGBTQ plus inclusive. So we provide technical assistance and guidance to help in that work. You can see more about this work at sageusa.org and then link to the National Housing Initiative to find out how you can get engaged with this work. We also have our new partnership model, which is called Sage Collab. And I'm happy to see that some of our Sage Collab partners are on the call with us here today. Sage Collab is a way that we work with local community organizations and support groups that are intentionally supporting LGBTQ plus elders. We provide a number of, resource tools and support and bring people together as a community to share and support one another in their work at that community level. We're very intentional about also supporting um, LGBTQ plus organizations that are focusing on Black, Indigenous, people of color, transgender and non-binary elders, as well as rural communities that are supporting LGBTQ plus elders. So again, if you know of an organization that may want to be a part of this work, we encourage you to direct them to sageusa.org and go to our Sage Collab section of the website. Another program that I work directly with is our National Resource Center on LGBTQ plus aging. We have a number of resources and toolkits that are available through this website to help you in your work and being more supportive and equitable for LGBTQ plus elders. And then finally, the next program I'd like to highlight is our Sage Care Cultural Competency Training. This program is really designed to help provide your staff with the training needed to make sure that they can offer the best support to LGBTQ plus elders. Again, it moves us beyond simply raising a rainbow flag or putting a rainbow logo on our website during Pride Month, but making sure that we've equipped staff and volunteers with the education needed to truly be equitable and supportive of LGBTQ plus older adults in your community. And feel free to follow up with me anytime after this webinar for more information on any of the programs that I've talked about here today. And I now would like to turn the program over to Lisa.
Thanks, Cheryl. Hi, everyone. My name is Lisa Schifferly, and I'm a Senior Policy Analyst in the Consumer Financial Protection Bureau's Office for Older Americans. My pronouns are she and her, and I'm going to share some information today about financial decision-making related to long-term supports and services. What are our options when a loved one needs long-term care? And then I'm also going to share some CFPB tools to help with financial caregiving and financial planning as we age. Next slide, please. Great, thank you. So first, what do we mean when we talk about long-term supports and services? We've been talking about it for a while now. And basically, we're talking about assistance with medical and personal care services. So it can include everything from basic physical activities like eating, toileting, walking, and bathing, as well as more advanced household management activities like grocery shopping, cooking, cleaning, healthcare, and money. And it also can include medical care and medication management. So this slide shows some of the options where older adults can get long-term supports and services. We know that many older adults want to age in place, staying in their own homes. And from hearing Cheryl and Lori talk, it sounds like that may be even more so among some LGBTQ plus older adults who are concerned about whether they will be supported in assisted living or other congregate care facilities. But for those who are unable to live independently or who choose to be a part of a larger community, there are a variety of types of communities, including assisted living, continuing care retirement communities, also known as CCRCs, and nursing homes. So I'm going to talk a little bit about each of those so that people understand what the options are if they're not familiar with them. But first, on the next slide, I do want to talk about the role of unpaid caregivers in delivering long-term supports and services, because these are kind of the unsung heroes. And we do know that 1 in 5 people in the United States act as unpaid family caregivers, according to an AARP and National Alliance for Caregiving in the USA report. So they perform 34 billion hours or $470 billion worth of unpaid work each year. And these family caregivers are not only unpaid, but they also usually are incurring costs of their own. As you see here, 78% have out-of-pocket costs due to caregiving, averaging about $7,000 per year, and 26% spend even more, about a quarter of their income on caregiving. These unpaid family caregivers can often suffer their own financial consequences, including stopping savings, taking on more debt, And a lot of them say they've experienced at least one financial impact, 45%, and 34% say they've experienced two or more financial impacts. And I wanted to particularly highlight this because given what Lori and Cheryl described in terms of data related to LGBTQ plus populations, it sounds like there are likely to be a lot of unpaid caregivers amongst those who do not feel comfortable moving into assisted living or nursing homes. But on the next slide, you will see some of the possibilities of types of long-term care. This slide talks about home-based care. Many people, like we said, choose to age in place if they can afford it and get care in their own homes. But here are some of the financial considerations. First, there's the cost. While any single service may cost less than a nursing home, many people are going to need multiple services. Like they may need homemaker services at $60,000 a year plus home health aides at $62,000 a year. So once you start adding those up, it can quickly become more expensive than assisted living or nursing home. There's also the coverage issue. States play a large role in determining whether and which home and community-based services will be covered by Medicaid. So getting coverage for home-based care can also often take months, even when it is available. Sadly, when I was at Legal Aid, we had a client who passed away while waiting for his Medicaid home-based services to be approved. On the next slide, you'll see information about HUD supportive housing. This is housing that is offered to certain people with disabilities under Section 811, as well as low-income older adults under Section 202. That's if their income is less than 50% of the area median income and they're over age 62. The challenge with this type of housing is that the supply of this housing is very low. There are long waiting lists and low vacancy rates. According to a 2006 study, some 90% of Section 202 properties maintain waiting lists, and many were closed to new applicants. And we know that over the next decade or so, demographic shifts are going to result in the older adult homeless population increasing significantly, nearly tripling by 2030. So there are going to be more people in need of this type of HUD supportive housing, and still the supply is low. On the next slide, you'll see assisted living. This is another option. I was very pleased to hear from Cheryl about the things that SAGE and Human Rights Campaign are doing in order to ensure that assisted living and nursing homes are LGBTQ plus friendly. These are homes, assisted living. A lot of people aren't really sure what the difference is between assisted living and nursing homes. In assisted living, you get assistance with daily activities like bathing, dressing, feeding, but not skilled nursing, not medical care like a nursing home. So that's the key difference. The other key difference has to do with the payment structure, because since room and board are not considered health care, Medicare and Medicaid do not cover those costs. So assisted living is basically out of pocket unless you have long-term care insurance that will pay for it. Another challenge is the lack of regulation. In many states, an individual can open an unlicensed assisted living facility in their own home, whereas nursing homes are regulated, assisted living often is not. And if you look at a recent case in South Carolina, it illustrates some of the limitations. In that state authorities recently shut 4 community residential facilities for posing an immediate threat to health, safety, and welfare of residents. They found no staff members present for extended periods of time, a padlocked kitchen restricting residents' food supply, and problems with medication storage and distribution. One also didn't have heat. So that can give you an example of one of the challenges of assisted living. The next option I want to talk about are continuing care retirement communities, or CCRCs. These are facilities that have independent living, assisted living, and nursing home care all in one place. And you can move from one to another as your needs change. There are different payment structures, some where you pay upfront and you can get any of the varieties over time, and another where you pay a smaller amount upfront and then pay more as you go to the higher levels of care. These can be particularly good for spouses or partners who need different levels of care but want to be in the same community. So if one partner can be in an independent living but the other still needs a nursing home, they can be nearby each other and even have dinner together in the dining hall. So the challenges here are the costs. They're not really accessible to low-income people. You usually have to pay a deposit, like a down payment on the house, plus monthly fees, which can vary depending on the level of care. And sometimes people don't fully understand the deposit structure and how and when you get your deposits back. The last option I want to discuss on the next slide is nursing homes. This is the one that most people think about and talk about. These provide skilled nursing and medical care in addition to assistance with things like bathing and feeding and other daily activities. So the cost of long-term care is a really growing challenge for older adults as healthcare expenses are exceeding inflation. The projected remaining lifetime cost of care for a healthy, and that's healthy, 65-year-old is $404,253. So paying for long-term care is quite expensive. This slide shows the nursing home cost broken down. I was surprised to see that the cost for a private room at $297 per day or $108 over $108,000 per year. It's not that different from a cost for a shared room, not that much less at $260 per day or almost $95,000 per year. So due to these high costs, very few people can pay out of pocket for nursing home care. In fact, 62% of nursing home residents have Medicaid to help pay for the costs. But of course, before you qualify for Medicaid, you have to spend down all your assets if you do have them, or almost all your assets if you do have them. So really, people are spending their retirement savings down in order to get the medical care and long-term care they need as they grow older. On the next slide, you'll see one consumer protection issue I just want to make sure everybody is aware of. Once you've chosen what type of long-term care is appropriate for yourself or your loved one, here's something to know if you do decide on a nursing home. The Nursing Home Reform Act of 1987 says that nursing homes cannot hold you personally responsible for the cost of the resident's care. So if you bring in your loved one and assign them into the nursing home, say you're bringing in a mother or a father or a friend or some other loved one, they can't hold you legally responsible to pay for that resident's care. So that is something that we have seen nursing homes abusing and want to make sure that people are aware of, especially somebody who may not have an adult child to bring them in and may have a friend bring them in. It's important to know that that friend cannot be held responsible for that care. So on the next slide, I want to turn a little bit to financial caregiving. So far we've talked about long-term care and those options. Another part of long-term care, in addition to where do you live, is how are you going to manage your finances. So I want to tell you about a relatively new resource we created at CFPB called Considering a Financial Caregiver, Know Your Options. This is designed for people early in the caregiving process. So maybe you're just starting to notice that a loved one might need help with managing their finances, or maybe you're planning ahead for your own financial future. This helps you to know your options, to know how to choose what works best for your particular situation. So it covers informal caregiving options like convenience accounts or adding a trusted contact person. It also covers formal caregiving options like power of attorney, guardian, or trustee. It gives you a list of questions to help you consider who's the best person to choose as your financial caregiver. So you can find this at consumerfinance.gov/MSEM, like managing someone else's money. And I'll tell you a little bit more about this piece. If you look on the next slide, you'll see that the piece does discuss 3 different types of informal caregivers. So these are people who just help out on an as needed basis. So a conversation partner can just be talking to someone about your finances, sharing with that trusted person, here's where you can find my bank accounts if you need to help out in the future. Of course, this needs to be a very trusted person that's vetted, and we'll talk about that in a minute. Another option is a trusted contact person. This allows you to just name somebody who's contacted if there is an emergency and if the financial institution sees signs of fraud or exploitation. So if I name my brother as my trusted contact and suddenly started wiring $40,000 overseas, he'd get a call saying, hey, check in on Lisa, there's something strange going on. So that person does not have access to your money or anything else. They just get notified in signs of exploitation. The last informal option we talked about are convenience accounts, which can allow you to help pay bills for someone without establishing the joint liability of a joint account. On the next slide, you'll see some of the formal caregiving options, and I want to particularly draw attention to these because it can be particularly important for LGBTQ plus individuals, although it's important for everybody to think about formal financial caregiving. But if you're someone who doesn't have adult children or who's in a partnership that is not legally binding, albeit committed, then it's particularly important to get a power of attorney or some other document to make sure that the person that you want is able to manage your finances if you become unable to do so. So the main way to do that is by creating a legal document called power of attorney, which assigns a person who will be able to manage finances when you're unable to do so. If you don't do that, you may have to go, or they may have to go to court to get guardianship or conservatorship if you become unable to manage finances and don't have anything in place. There also is information about trustees and government fiduciaries. If you look on the next slide, you can see that we have guides about each of these roles. So we have our managing someone else's money guides. If you are finding yourself as somebody who is serving as power of attorney or a guardian or trustee or any one of these formal fiduciaries, these guides help you walk you through what your rights are, what your responsibilities, and what you should be doing. Now, on the next slide, I just want to talk about choosing a financial caregiver. That's the last and probably the most important part about considering a financial caregiver. Know your options. That has some questions for you to think about in terms of choosing a financial caregiver. And we're encouraging people to not go to the default, which for many years people just made the financial caregiver the oldest son. But really think about who is the best person for this role. Is it someone who you trust? Do you feel comfortable sharing your wishes with them? Will they carry them out? Think about the hard questions like, do they have an alcohol, drug, or mental health issue that might cause problems with them managing your finances down the road? Because unfortunately, we do see a lot of adult children and others who exploit older adults in order to feed different addictions. So other questions to think about are, will they make decisions in your best interest? Will they share the money or property? Will they keep their money and property separate from your own? And will they be able to keep good records? So those are some of the considerations when you're considering a financial caregiver and considering somebody to help you with long-term care supports and services. On the last slide here, I just want to leave you with some contact information. You can find all of our resources at consumerfinance.gov/older-americans and can reach us with any questions or information at older-americans@cfpb.gov. And then the considering a financial caregiver, know your option, as well as those guides, managing someone else's money guides I described, you can find at consumerfinance.gov/MSEM. And my information is there as well. We'll be back to answer questions at the end, but you can feel free to email me after the presentation as well. And thank you. And with that, I'll turn it over to Ari.
Thanks, Lisa. Hi, everyone. I'm Ari Lazarus. I'm a consumer education specialist with the FTC's Division of Consumer and Business Education. Before we jump into talking about home repair scams, I wanted to give a quick overview of our office. Our mission is to give people the tools they need to make informed decisions and give businesses the tools they need to comply with the law. So today we'll be doing the former and going over some advice on how to avoid home repair scams. Next slide, please. Okay, so this is a topic that affects everyone, but with today's presentation, I wanted to highlight that older LGBTQ folks might experience more home repair fraud than others. And that's because, as Lori said, they're more likely to live alone and perhaps don't have anyone to help them vet a contractor or shop around for options. but there's still ways to spot and avoid these scams. So if you've ever owned a home or been responsible for maintaining one, you probably spent money on needed repairs or maintenance. And you know that home repairs can be expensive. They come up when you least expect them or happen because of a hurricane or other natural disaster. When these issues come up, we often have to rely on the expertise of the contractor, and scammers can exploit that trust, taking your hard-earned money and leaving you with shoddy repairs or no repairs at all. Next slide. So how can you spot a home repair scammer? There's a few telltale signs. If they knock on your door looking for business because they claim that they're, quote, in the area for a limited time only, or they say that they'll cut you a good deal because they have materials left over from a previous job. And another big flag is if they pressure you for an immediate decision, don't do it. Also, you want to pay special attention to the payment terms. Scammers are likely to ask you to pay for everything up front or only accept cash. When someone asks for full payment up front, it's a scam. Some scammers will offer to arrange financing, but they'll want you to borrow money from a particular lender that they know, and they won't give you time to shop around, so you won't know that it's a bad deal until it's too late. Next slide. Okay, so home repair scammers want your money and they want it urgently, but they're not going to accept just any kind of payment method. So in addition to cash, home repair scammers might direct you to pay by sending money through a payment app like Venmo or Cash App, or wire money through companies like MoneyGram or Western Union. Don't do it. Paying contractors using these payments methods is like sending cash. They're almost impossible to reverse and trace. And like I said, other times the contractor might try to persuade you to take out a loan to pay for repairs, but it's all part of the scam. You'll end up with an expensive loan that can trap you in debt. Next slide. So what happens next? Scammers run off with your money and never make the repairs that you paid for. Or maybe they make shoddy repairs that make things worse, and then they try to make you pay to fix the problems that they themselves created. And lastly, they might get you to sign a bad financing agreement with one-sided terms and unaffordable monthly payments. And then if the loan is secured by your property, your home could be at risk. Next slide. Okay, so what can you do to avoid these scams? Before starting expensive repairs with a contractor, you want to remember this advice. First, you want to check with people you trust for recommendations of contractors to hire. And you want to shop around. You want to get at least 3 written estimates from 3 companies before deciding who to use. And you want to ask for references, plus proof of license and insurance. License and insurance are important to check for. They give you more protection if something goes wrong. Lastly, don't start work until you have a signed contract that you understand. So don't be afraid to ask questions before you and the contractor sign it. Because if something goes wrong, a written contract gives you a lot more protection. Without a contract, it's just your word against theirs. Next slide. Okay, so the FTC's campaign, Pass It On, is all about having these conversations. And so we're really hoping that you're talking about these types of scams with your friends and family, because you have this life experience and you know about a lot of things, including spotting and avoiding these types of scams. But you probably have someone in your life who might benefit from a little extra help or information. So pass it on, talk with them, share your experience, give them a flyer or a bookmark to help remind them. Let them know where they can find more information on the FTC's website, which is ftc.gov/passiton. And I'll talk a little bit more about that campaign in a minute. Next slide. Okay, before I get more into Pass It On, I do also want to do a quick plug for reporting scams. So if you or anyone spots a scam, the FTC wants to hear about it. You can go online to reportfraud.ftc.gov or call 1-877-FTC-HELP. When you report fraud, You help FTC's investigators identify scammers and stop them before they get someone's hard-earned money, and it really makes a difference. Next slide, please. Okay, so back to pass it on. So if you're looking for more ways to kind of work with the campaign, you can get started by ordering the sample packs at ftc.gov/bulk order. Sample packs have fact sheets about 13 topics that often affect older adults, like impersonator scams, health insurance scams, and job and money-making scams. You can get these sample packs in English and Spanish and give them to other folks who would be presenting. They're not meant as a handout. They're really meant as a way for folks who kind of do presentations in the community to understand the full scope of the campaign and to kind of see all the topics. So as you read through the fact sheets, you can think about what's going on in your community, what issues are top of mind for older adults, and how you want to reach people, whether that's in person, virtually, by phone, or some other option. Next slide, please. Okay, so while the sample pack is for presenters, you can also get materials to hand out. When you want to do an in-person presentation, you can order tear sheets or fact sheets by the topic that you choose, and packets of bookmarks. That way you'll have a stack of materials on your topic ready to share. And again, they're all in English and Spanish. Here you see the pieces of an in-person presentation, a fact sheet, bookmark, and PowerPoint slides. In this case, it's for investment scams. The PowerPoint presentations are usually 8 to 10 slides and includes notes. Today's presentation was actually mostly pulled from one of those decks, so you can see how short and easy they are to use. They're usually just enough for you to do a 15 to 20-minute presentation, including discussion topics, which we cut off today due to time. But you, again, can find those all at ftc.gov/passiton. Next slide. Okay, and from here, I just want to thank you all and pass it back to Cheryl for questions. Thanks.
Thank you so much, Lori, Lisa, and Ari, for your insightful information today. We do have a couple of questions that I'd like to start us off with. As soon as I get back to them, just a second. So one of the first questions was around the Nursing Home Reform Act, and specifically, this person asked if, let me read it so we get it right. While they might not be required to pay by law, are they required once they sign the admitting paperwork where that person is listed as the payee?
Well, that's a good question. I mean, you probably would have to file suit if you thought you basically had signed an illegal nursing home contract. If it was something that was requiring you to pay out of pocket for a resident's care, then that's illegal according to the Nursing Home Reform Act. But that doesn't mean the nursing home's not going to try to come after you for the money. That's why we're hearing about this, is nursing homes are suing people for this money, and then legal aid attorneys and others are representing people saying, no, you can't do that. That's illegal. It violates the Nursing Home Reform Act. One other caveat that people should know about is if you are serving as a power of attorney or guardian for someone, then they can require you to pay out of that person's funds for the care, but they can't require you to pay out of your own funds. Another caveat is if you are married and, have joint accounts, then that may be different. But what we're talking about here is, say, it's oftentimes an adult child bringing in a parent, or it's friends bringing in friends to nursing homes and then being on the hook because they signed something. Because when you're in that situation, you're desperate to get the person in a good place that has a bed available at that time. So a lot of people are understandably willing to sign whatever. So just people should be aware if they're in that situation to get legal help if they need it.
Thank you, Lisa, for that. Ari, it looks like this next question is directed to you. And the question is, there are a number of resource lists that people can find online. Sometimes you pay for them, sometimes you put in your zip code and you end up getting calls from potential contractors. Are those types of lists generally safe?
Yeah, that's a great question. Yeah, I mean, we can't comment on individual companies. But yeah, I mean, I think it's a decent place to start. I mean, I think we definitely encourage folks to talk to folks that they trust and, folks in the community who might have recommendations. But if you need to kind of start with one of these lists, that's somewhere to start. And then maybe do your own independent research. Like if you find a company on one of these lists, then you want to go back to a search engine and search for the name plus like complaints or other things. Folks also should just be aware that, all reviews aren't legitimate. Like fake reviews are definitely a thing. And so unfortunately, you can't just trust good reviews at face value. But they can be hard to spot. So it's definitely tricky. And that's part of why you also are going to want to try to shop around and get like 3 different estimates. So you're at least interacting with several different companies.
Thank you, Ari.
No.
Lisa, did you have any comments there as well? Okay. Lori, I have a question for you. Be ready, here it comes. So, we talked some about caregivers and, caregivers paid and unpaid. So whether it's a caregiver through a organization or maybe a family caregiver or a friend that's caregiving, sometimes we can also see financial exploitation at that level. And, from the National Center on Elder Abuse, how might folks go about being more informed about financial exploitation, and if they feel that they are facing this type of financial exploitation, what steps can they take?
Hey, thanks so much for the question, Cheryl. Yeah, this is certainly an issue of financial exploitation from family members or chosen family, as well as financial exploitation from strangers. It can be difficult to detect because the person, especially financial exploitation by someone close to you or someone known to you, they have that close proximity. They have perhaps knowledge of your resources, perhaps access. It's possible they were given power of attorney, or they have guardianship or conservatorship over the older adult. So it becomes very complicated. A lot of times people get in these situations not knowing that it's occurred. So, but if abuse is perceived, there are opportunities to report it. Abuse by family can be reported to Adult Protective Services or the Long-Term Care Ombudsman. If other families may be around, non-offending family members, they also can be an effective resource, or friends, people in the community who see what's going on and can be of assistance to help people support a decision making. Yes, and reporting to law enforcement. Thank you very much.
Thank you, Lori. Really appreciate that. Another question that we have is, do we provide trainings for public libraries? So I'll let the 3 of you address that.
We do. We love libraries.
We do too.
We love libraries more than Lisa. No, no, we absolutely do trainings for public libraries. We do lots of outreach. So yeah, if you want to reach out to me and or Lisa, I think we'll probably just share your information between us. So I'll put my contact info in the chat.
Yes, both CFPB and FTC have robust library outreach programs, because we know that libraries are a great way to reach people, especially low-income people and older adults. So.
Thank you, Lisa and Ari. And, for the National Resource Center on LGBTQ plus aging, we have slide decks that we can provide to folks who want to do education internally, at your own organization, or offer a community presentation. So, feel free to reach out to me afterwards if you're interested in that information. Any other questions? We have about 5 minutes left. I hate to let people out early. So not seeing any further questions, for the panelists, do you have any closing remarks? We'll start with Ari.
No, I just thanks everyone for coming. Really appreciate it. And yeah, please reach out if you want to learn more about our outreach to older adults and to the LGBTQ community. We're always looking to partner. So do reach out. Thanks.
And we did have one last question that just came in right in the nick of time. Climate related scams. Are you all starting to see scams related to climate change or products out there?
We're definitely
Yeah.
seeing weather emergency related scams, which some may say is related to climate change. So a lot of scams related to, relief and home repairs after hurricanes, tornadoes, wildfires, and the like. And I know both FTC and CFPB have special weather emergency pages that let people know how to recognize and avoid those scams. But Ari may have more to say.
Yeah, I mean, in general, scammers follow the headlines. And so I think with all this climate change stuff in the news, it's, bound to happen. I don't know off the top of my head if that has been the case. If you reach out to me, I can see about getting back to you on that. But it's definitely plausible. I wouldn't put it past them. They're constantly making up new and innovative things.
Thank you, Ari. And, I would say along with any of this information that we've shared today, people that are involved with trying to defraud folks and do these types of scams, they're smart. And, I think it's important that we really share with our communities, our audiences, that this happens to so many people. And the main thing is to not feel ashamed and embarrassed and to reach out and seek help, should this happen. So any closing remarks from Lori and Lisa?
I just wanted to thank SAGE, FTC, and NCEA for being partners on this webinar and the earlier webinar and our networking outreach event. So it's great to work with you all, and hopefully we'll have more events like this in the future.
And I would echo Lisa's sentiments, thanking all the co-presenters and commending Sage and Yusha for all the incredible work that you do, especially with the LEI index and all the incredible products you have to protect and help older people. Thank you.
Thank you, Lori, Lisa, and Ari. I believe we're all part of the same fan club for one another. So, again, just really appreciate your organization's partnership in this work and really trying to, promote LGBTQ plus equity across the country. Again, this webinar has been recorded. It will be available on our website at no, that is the wrong website. Sorry. At lgbtagingcenter.org. You'll all get an email tomorrow, and it will also have a link to where the webinar will be housed, and we'll also provide the Q&A for this webinar and a list of resources that we've talked about throughout the webinar. So thank you again so much. If you have ideas for future sessions, please feel free to drop them in the survey that will be popping up as you leave the room today. Thank you all and enjoy the rest of your week.